This conference is being recorded.
Great. So today, like I said, we're gonna jump into the actual treatments, and I always like to mention that what I'm giving you is some of my perspective, right? The treatments are varied, and you can take all this information and bring in other areas of your specialties to inform this or layer into this, what have you, because I would never presume to tell someone how to treat. I'm just going to show you how I treat, okay? And so, but all the treatments, we just want to make sure that we're factoring in all the different strategies and the major impacts and the sequela of the diagnoses and over time in those manifestations, okay? So, before we jump into the primary channels, I do just want to mention some of the distinguishing factors about why we would choose certain channels over other channels potentially as we're going through a particular patient, right? So the primary channels, we're looking kind of at the five, at least how I envision it, the 5 phase approaches or specific lineage approaches. And by lineage approaches, I mean certain lineages use certain points for certain functions that may or may not be commonly known or used in other lineages, right? So there's certain things that I've learned from Dr. Hammer, certain points that I find to be very effective, and partly because through the lineage, through the explication of what those functions are, and through the usage of it over time with patients, you start to cultivate a relationship with those particular points, right? And so over time, they may work for you because of that cultivation, where someone else jumping in and using those points without the proper intention or understanding or how it factors into the totality of these approaches, they may not get the same response. And so that's not an uncommon phenomenon, right? So, and with that approach as well, the more you use some of that and the more your intentionality is applied towards a particular functional point, the more over time it starts to work for you, right? So it includes also understanding and potentially using point names and symbolisms and stuff like that. It also includes this idea of the progression theory that we're going to talk about a little bit as well. And then, factoring in, again, lineage approaches like ghost points and those types of strategies. The sinew channels, we're dealing here with a channel system that primarily is looking at Wei Qi and the dynamics of Wei Qi, right? And we've talked about the nervous system in significant detail yesterday. So things that are reflecting nervous system functioning, reflecting Taiyang energetics and the Shaoyin relationships to that. We're thinking of things where there might be significant pain or armoring or tension in the musculature and how that implicates certain emotional responses, or I should really say more so mood relationships, right? Because mood, if we distinguish mood, emotion, and temperament, moods are more Wei Qi oriented, right? So moods are going to be something that is reflective of someone doesn't attach a particular reason to why they're in this mood. It's kind of like, there's this, the weather patterns change, things are cycling, they kind of feel, it's cloudy out, they feel a little down, they're not like attaching it to a particular life situation or disappointment. Once you start to understand and attach a reason to why you may be angry or depressed, now you're utilizing the blood, right? You're attaching blood to that situation, and you can consciously be aware of what's happening, and that's really in the realm of the yin level, the blood level, right? The low vessels. And the primary channels, of course, are dealing with Wei and Yin, right? So we can think about utilizing them there too. The cool thing about the yin level, when you're attaching blood to something and you're attaching your shen to something, is you're now consciously creating decisions, right? You can make choices about whether you want to maintain your adopting a particular stance or a perception towards why you may be angry or sad or depressed or what have you, right? So that starts to kick in the realm of responsibility, right? So someone who's constantly cycling the same narrative over and over and over again, they're deciding to think in a particular way or to adopt that particular stance. And not that it's easy necessarily by any means to shift the way you think, but one can make conscious decisions to do that and perceive things differently, right? And then you move into the UN level, which is more about one's temperament, one's nature, one's stance in life, right? And so that is something that tends to be more associated with divergent meridian energetics, with 8 extra vessel functions, and so forth, okay? So as we're dealing with the low vessels, right, we would be looking at things like Shen features, disturbances, things that affect the blood, inflammatory conditions perhaps that are dealing, internal dynamics, pain, right? Not, low vessels don't penetrate the major articulations. That would be more something that we're looking at towards divergent meridians going into the joints themselves. But we know classically that low vessel theory is something that deals with pain, right? It deals with rebellious qi, right? It deals with Shen disturbance, right? It deals with inflammatory conditions in the organ systems, right? Especially like when we're talking about the transverse low rather than the longitudinal low, which is dealing with more of that rebellious qi and blood stasis and so forth. The divergent meridians are looking at dynamics of the combination of Wei level energetics and UN level energetics, right? So it kind of bypasses the Yin level to some degree, or to a large degree. Oh, there are interrelationships, of course. So here we may be exposed to something externally, a pathogen, and again, that can be an emotion, potentially. It can be, or a mood, I should say, something that comes into the system very strongly. It can be bacteria, something external. It could be, EMFs, right? Things like that. And those are things that are going to impact the Wei level and then start to move towards and attack towards the organ systems themselves, and the divergent channels translocate the pathogen and move it away, right? So here we discussed a little bit yesterday about arthritic conditions and holding things in a state of latency, right? Chronic sinusitis, chronic gingivitis and gum disease, and the constant need for, root canals and so forth, where we know that pathogens tend to reside in those bony cavities and go latent, right? So here we're looking, of course, to assess quantity and quality of the resources to maintain that latency, and we're deciding whether or not we're bringing something into a state of latency versus trying to release something out of a state of latency, right, to clear something, to clear a pathogen. And that is going to be determined by the constitution and the availability of those resources to actually move something through, right? And so in the course of someone who's experiencing trauma, do they have the capacity to bring this trauma back up into the Wei level so that it can be discharged? Do they have that integrity? Does the lung have the ability to diffuse qi out and release something out to the surface? Do they have enough thin fluids to sweat something out, right? Because to discharge something from the body typically requires a resource, right? So you sweat something out, the fluid moves it out through the pores, bless you. You get a cold or a flu and your nose runs and the mucosal discharge pushes a pathogen out, right? We sneeze things out with a fluid. We cough things out as we get phlegm out of the body. If we don't have the resources, those humors to do that, things can get stuck in the Wei level and create additional problems for someone, right? And we want to make sure we don't allow that to happen. Okay. And then 8 extra vessels and that kind of channel pathology would be things that really are addressing primarily on the UN level and the Jing level, right? Things like pediatrics, geriatrics, genetic problems, those sorts of things. Okay, we get more than that, but that's a basic simplified classification. Okay, so today like I said, we're going to be really honing in on the primary channels, but you will see me make reference to the other channels, because obviously the points on the primary channels also become points on the other channels as well. And so as we start to move fluidly between the dynamics of those points, it helps us move fluidly between tapping into different channel systems all within one particular treatment, right? And we'll see that right away when we jump into the metal phase.